Can I start, sir?
Yes, we can start.
Good afternoon, everyone. I'm Dr. Kirti Suda. Welcome to FB Live session from Dr. Makkar's Diabetes and Obesity Center. Welcome, sir.
Thank you, Dr. Kirti. Good afternoon, everyone.
The topic of today's session is FAQs on diabetes. Actually, sir, it sounds very interesting.
See, whenever somebody gets diabetes or somebody in family has diabetes, there are always a lot of questions. So it is always good to, keep discussing different questions that we keep getting on day-to-day basis in our clinical practice. And there, as you have seen, most of the patients have very similar questions.
Yes.
So if they know the answers to those basic questions, I think they are in much better situation to manage their diabetes well.
But it's an effort of ours to provide them with the scientific knowledge, basically.
Yes.
And we're actually seeing to the present prevalence of diabetes, pre-diabetes, and gestational diabetes. It's mandatory for all of us to know about diabetes. Whether we are a diabetic or not, we should know what exactly is diabetes.
Yes, of course.
So, sir, my first question to you for the day is, what exactly is diabetes?
So diabetes basically is a disease which is characterized by increase in blood sugar levels, which is the hallmark of diabetes. Diabetes basically means, it is derived from a Greek word. So diabetes basically is associated with increased urination and increase in glucose in blood. That was the initial concept. But currently, to just in simple words, the diabetes is a disease which is characterized by a hallmark finding, which is high blood sugar levels. Now, why it is important? Because these high blood sugar levels, they are so we all understand that blood is going to every single part of the body. Now, if the blood sugar levels are high, every single cell or tissue is exposed to high sugar levels, which are higher than the normal. And this high level of sugar damages all these cells gradually in long term and leads to a lot of complications. So that is why it is important to diagnose diabetes as early as possible so that we can cut down the duration of exposure of different body cells to high blood sugar levels and prevent those complications.
Interesting. Sir, is it so that people who consume excess sugar become diabetic?
So there are chances, there are higher chances of these people getting diabetes that we have seen in Indian setting. There are not many studies on that, but yes, in India there are studies which have shown that higher sugar consumption or higher sweets consumption is also associated with increased risk of developing diabetes, especially type 2 diabetes, which is the most common type that we see in adult patients.
My next question to you is, if one becomes diabetic, how should he take care of his problem?
So first thing is, once you know that somebody has got diabetes, it is not to be neglected. It is to be taken seriously. And I tell all my patients, and it is not that I tell, whatever data we have and whatever clinical research has shown till now, that diabetes is equal to damage done by a heart attack. So diabetes is considered as cardiovascular equivalent. That means studies have shown that people who develop diabetes and have no heart disease, and people who have suffered one heart attack and do not have diabetes, both have same chances of getting a heart attack. So getting diabetes is equal to getting a damage caused by a heart attack. And 80% or 75 to 80% of diabetes individuals are likely to die of heart attacks. So the risk is very high. And that is why once you get diagnosed diabetes, first thing is you must consult your physician, your family physician, whoever you want to go to. But get it, checked by a physician, get all your investigations done and follow the advice and make sure that your blood sugars are controlled as quickly as possible. Do not delay it. And second thing is, there is something called legacy effect. So if blood sugar levels stay high for longer duration, there are increased chances of getting complications earlier in the course of disease. If somebody has very good control of diabetes right from beginning, and say after 5 years or 10 years the control worsens also, the chances of getting complications are less as compared to a person who has bad control in the beginning and good control later on. So there is legacy effect of bad control of glucose, and if there is high sugar level, then chances of complications will increase. So it is to be taken seriously, immediately attended, and person should be on treatment as of now for rest of his life. Should not try to run away from medicine.
Sorry to interfere, sir, but thing you pointed out is the first thing should be to not to be unattended. But
Yes.
what in our clinical practice we see is the people they follow all the things available, OTC. They every person is a doctor over here. Inculcate methi, karela, neem, and whatever so is available in our kitchen or OTC, and then they come to us. So how do you see this thing?
So basically, one is the myth that since it is related to sugar or high sugar levels in blood, consuming bitter things will bring down the sugar levels, right? So people will tell that you can consume karelas, methi, and everything. But then I ask them question that why don't you drink alcohol? That is also very bitter. Does it bring down sugar? Actually, it brings down sugar. The problem is it can suppress your glucose level so bad that you can get into coma if it is not, taken carefully with diabetes patients. That is why it is to be avoided in diabetes patients. But the problem is it has nothing to do with eating something bitter or something sweet. The important thing is overall there is need for changes in the lifestyle intervention, which includes increasing physical activity and consuming healthy food. Healthy food means that you should be consuming appropriate ratios of carbohydrates, proteins, and fats, consuming adequate calories so that you don't gain weight, you don't lose weight if it is not required, and eat on time so that your sugar levels are matching with the action that is provided by the drugs, and at the same time you don't end up in situation of low sugar levels. So healthy food contains adequate proportions of all macronutrients, micronutrients, adequate fruits and salads. That gives you a good, control of diabetes as well as provides a healthy lifestyle.
Next, very important question which comes to our mind is diabetes curable? Can we cure it?
So as of now, we do not have any evidence that diabetes is curable. Diabetes patients can go into remission for a while. This can happen with type 1 diabetes. Type 1 diabetes is in children. We usually don't get into detail of that much because there the child should never be, self-treated by parents. Child should always be under care of a good diabetes physician because they need to be on insulin all the time. And if they discontinue insulin, the risk can be life-threatening also. In type 2 diabetes, again, there can be remission with intensive lifestyle intervention, especially if it is tried in early in the course of disease. So in first 5 to 6 years of diagnosis of type 2 diabetes, if you, follow intensive lifestyle interventions with diet, exercise, and some medications, but this is to be done under medical supervision. It is not to be attempted, unsupervised. Otherwise, person can totally go haywire. And that can lead to remission of diabetes with very good probability. Early in the course of disease, studies have shown that as many as 80% of the persons with diabetes can get into remission if they are properly, subjected to lifestyle intervention and medications in a supervised setting. So remission can be there. But there is a strong genetic predisposition, family history, and other epigenetic factors which also determine the course of disease. So it is unlikely that somebody will get cured, but remission is possible. But that remission also helps in changing the glycemic legacy, the legacy effect of bad glucose control. So somebody is in very good glucose control, say even 5 years or 10 years during remission, then the whole course of complications will be delayed and the quality of life will be much better.
So
But
these,
cure is not, as of now, we don't have cure for diabetes.
right, sir. So there's a lot of advertisement these days regarding reverse your diabetes. Reversal is possible. So how do you take this thing?
So I just mentioned, reversal actually is, reversal means like you are reversing your car. So you have driven, say, 100 kilometers. Even if you reverse for 100 meters, you have reversed your car. So once, say, if somebody has come to us with glucose level at 300 and we bring it down to 200, again, we have reversed some, diabetes. So reversal is very, difficult term to interpret. The better term is remission. If reversal is being interpreted as cure, it is wrong. You can reverse from diabetes to normal state, that is remission. Now, how long somebody will stay in remission will depend on multiple factors. How strong is the genetic predisposition? How are the environmental factors where person is living? What is the family situation? What is the home environment? What is the eating habits? And then how strong is the genetic predisposition? All these will determine how quickly that remission will end up or how long the remission will go on. But remission only means that now you are in a normal state as far as your glucose levels are concerned. And some point of time, this state will reverse back to high blood sugar levels, right? Reversal, the mostly people interpret as that now once you have reversed, it will not come back. But it is likely to come back.
Sir, another very important point which is to be taken care of is that people are in this myth that their medication will go off with this remission. Is it true?
So with remission, we can put the patients off medication. That is true, but there are different schools of thought. So there is one aspect is that since you have put the patient into remission, why do you want to continue that medicine? If you are continuing medicine, would you like to say that patient has already got into remission? This becomes a discussion point. But there is second school of thought is that now this patient has gone into remission and we know this person will come back with diabetes. Now, why don't we put this person on intensive prevention mode? And we should use medication to prevent, diabetes. So there are two different schools of thought. Of course, once person is in remission, you can do without medication. And some people would like to continue medication also.
So next very important point which we face is regarding alcohol. Patients have this question in their mind, can they consume alcohol?
So I briefly touched on that point. So they can consume alcohol, but there is one thing which one should understand. See, during night, when you eat your meal at say 9 o'clock at night or 10 o'clock, and then till morning 8 o'clock, you are not eating anything. So your glucose levels tend to fall in normal individual. Now, what happens during night is liver produces glucose to maintain normal glucose levels. Alcohol is a suppressant of liver function. So it suppresses glucose production by liver. Now, if somebody is on diabetes, having diabetes and on anti-diabetes medication, this alcohol, in addition to other medication, can precipitate very low sugar levels. Person can go into severe hypoglycemia and, even get into coma, which can be a very bad situation. So somebody who has to take alcohol, it is to be taken only in moderation. That means not more than 60 ml recommended for male persons, and not more than 45 ml is recommended. 30 ml is recommended for women with diabetes on daily basis. No binge drinking should be done. But also you have to keep in mind that diabetes leads to damage to nerves, and alcohol can also cause damage to nerves. So if somebody is taking alcohol in moderation is fine. If somebody is taking excess, this is strict no, this can be damaging. And if somebody is not on alcohol, should not initiate alcohol as a habit.
Next question is, can I include all fruits in my meals?
So practically all fruits can be consumed, except for few fruits which have very low fiber and high content of sugar, like dates, like chikus or lychees, which are very high on sugar and low on fiber. But in moderation, mostly fruits can be consumed. The fruits with higher amount of fiber, like apples, guavas, even oranges, or these are good fruits. Person can consume say about 200 grams, or medium sized fruit both morning and evening is not a problem. One should avoid all kinds of juices. Even vegetable juice is of no good, because you are taking out fiber, which helps in reducing the glucose absorption and improving glucose levels. So focus should be on consumption of fruits and vegetables, and as salad and cut fruits, rather than going for juices. Most of the fruits can be taken. The most common question comes relating to mangoes in India. So mango again has very low fiber and very high content of sugar, and the glycemic index is also high. So best is to take a slice of mango and not full mango. And if you can take, if you are taking it after a meal, the sugar level that is there gets mixed up with the food in stomach, and the absorption goes down. So it doesn't really kill. But if you want to have 2-3 mangoes every day, it is not possible. Second thing is, I repeatedly keep telling that sugar taste is something which, or sweet taste is something which lasts for a pretty long time. So suppose you have taken half a spoon of sugar and you consume tea after that, it is, without sweet taste. It appears that there is no sugar in that. Similarly, if you have taken a sweet and you eat any other sweet thing, actually you will not find sweet taste in that unless it has more sugar than the previous one. So you, after first bite of a sweet food, actually whatever you eat is just sustaining your taste. It is not giving any additional advantage. So you should eat only small amount of sweet food, whatever you want to eat, and then enjoy the taste. Don't fill up your stomach with that sweet, because ultimately you are consuming excess calories. For taste, you need only small amount of that sweet. Second thing is, once people eat sweets, then there is, most of the Indian sweets are full of ghee or oil, which has even higher calories than sugar, and that is what worsens your sugar even worse. So you have to be careful, and you should actually be under guidance from a nutritionist or your physician what exactly you should eat and how much you should eat. Most people avoid going to dietitians for a proper diet planning also, but I think it is very important to have a structured diet plan which can be easily followed to have good control of sugar.
We just say one thing, know your food.
Yes,
So
important.
next question which came to me is, can I eat potatoes and rice?
Yes, of course, everybody can see. So whole of South India eats rice. Can we stop? We tell them not to eat rice and manage their sugar, or the whole world nobody eats chapati. Everybody eats rice or breads of different kind. What do you tell them? Do we teach them to make chapatis? Then only their sugar will be fine. So whatever you are eating, staple food has a good amount of carbohydrates. In Indian diet, we eat more carbs than any other part.
Yes.
So we eat carbs with carbs. Even the lentils we eat is full of carbs. All dals, all, vegetables, atta, everything is carb. So is rice also. Rice has higher glycemic index, that it gives a sharper increase in sugar level. So best thing is that you should choose. Now we have low GI rice also available in the market. So you can choose the varieties specifically which have low glycemic index. Otherwise, you can take, common brown rice, unpolished rice. Don't go for basmati. You can use unpolished rice. Or whenever you are eating rice, make sure that you are mixing it with adequate amount of green vegetables, which have a lot of fiber, or the lentils or dal that you are eating with that should not be what do you call is
Bina
the
chilka.
should be whole dal. It should not be the processed dal. So it should have the shell with it so that you increase fiber content. So if you increase fiber content, the glycemic index will be moderated significantly. But certainly everybody can eat. See, same is with potatoes. If you want to have the whole meal of potatoes, of course you will have a significant rise in sugar. But if you have 4 or 5 pieces of potatoes in your, whole bowl of vegetable which is mixed with beans or something, it doesn't kill. You can eat everything, but important thing is you should know what you are eating, and moderation is the key.
Interesting. The best example of carbs with carbs is aloo ka paratha.
Yes. No,
Anything.
any dal roti is also
Yes.
carbs with carbs. Dal is only 19% protein, 80% is carbohydrates.
Basically, we are carb based diet.
Yeah. So average consumption in India is about 70% of the diet composition, 65 to 70% is carbohydrates.
Very true, sir. So, what is the most important part of diabetes management?
Most important part is
Yes.
never neglect it. Always take it seriously. I think that is the most important part. If you take your disease process seriously, then you will pay good attention to it. You will get yourself, checked by or examined by a physician on regular basis. You will get your investigations on regular basis. You will keep checking your sugar regularly, making sure that your fasting, your post meal values are on target. Whatever is recommended, you follow that as lifestyle intervention. You are regular with physical activity, moderate eating, eating on time, regular medication, regular testing, making sure everything is on target as per advice. So I think that is important, and this will happen only if you are serious about your disease. If you start neglecting it, you will never know where you go wrong.
And usually, what happens is the initial few years we all waste, and then when height is there, then we go to the doctor.
Yes. Important thing is, for first 3 months, patients will be in panic that I've got diabetes. What should I do? What? So once they get controlled, then they start thinking now everything is okay, and then they disappear. They will forget about testing. Suddenly they'll come after 1 year and, sir, my sugar is again bad. So why didn't you come? Why didn't you come for regular follow-up? Why are you not testing? All these questions will be repeated, multiple times during the course of disease. So I think it is very important to have a regular monitoring of glucose. And another important thing is diabetes is not just sugar. So if somebody has diabetes, especially type 2 diabetes, we are talking adults with diabetes, they have high risk for developing hypertension, which is high blood pressure, high risk of developing heart disease, which I mentioned very clearly in the early part of my discussion. They have very high risk of developing strokes. They have high risk of developing kidney disease. They have high risk of developing eye disease. They have high risk of developing neuropathy and foot problems, which can go, to worse situation of amputation of feet or leg. Where we know all these complications can happen. So it is not just sugar that you are focused on. So if you are under regular medical treatment, then your physician is also keeping a track on all these things. And if there is a complication which is coming up and detected early, you can manage it properly. But if you end up in advanced stage of complications, actually nothing much can be done. So it is not just sugar. You have to control sugar. You have to make sure your cholesterol is normal, your kidney function is normal, your thyroid function is normal, vitamin D levels are okay, B12 levels are okay. Everything you have to keep checking on regular periodicity.
Can I take one question
Yes,
from
sir.
the audience?
Yes.
Is it true that insulin causes sodium and water retention for a heart failure patient?
The it causes sodium and water retention, and if the patient with heart failure is actually uncontrolled or decompensated state, it can worsen it. But it does not cause so much sodium water retention that a person with heart failure who is controlled and stable will get into worsened state. It is very unlikely. And in fact, most of the time till date, we have now some new medications which are useful in treatment of heart failure. Till date, if the person is heart failure and decompensated, that means in a bad situation, then insulin has been the treatment of choice, because during that period you can't give oral medication. You have to keep monitoring sugar and give intravenous insulin. Even now, insulin is still one of the important choices for treatment of heart failure patients. So stable patients on heart failure, there is no issue. Acute critical state, again insulin needs to be given. So it is not nothing that is contraindicated in heart failure patients.
Basically, sir, it's the doctor who has to take the decision.
Yes, yes.
So we have touched on the question about fruits, but in very specific, can you answer this question? What all fruits we have to avoid?
So fruits which have high content of sugar, like dates, like mangoes, lychees, chikus, or bananas, which have low fiber, high carb. Grapes are very high on sugar, but they have still good amount of fiber also. So few grapes, if you are eating, there is no problem. So these are the pineapple is one. So these are the fruits you should avoid. Rest all the fruits can be taken in moderation. There is no problem.
Thank you, sir. So my next question is regarding exercise. Why is exercise needed in diabetes?
So, exercise helps in toning up the muscle and improving muscular function. Muscle is one of the areas where there is insulin resistance. So, with more physical activity, you actually improve circulation. Uh, with more physical activity, you also improve the cardiac tolerance, the heart fitness you improve. You improve the fitness level of lungs. So this is called a cardiorespiratory fitness that you improve. You improve your stamina. Your with increased muscle activity and more buildup of muscle mass, your insulin resistance comes down. You have more efficient metabolic functioning, leading to improvement in glucose levels. You bring down your triglyceride levels. Your joints function also is better. Then if you are having good physical activity, basically all the muscles that you are moving are attached to the bones, and they strengthen the bones. During exercise, you also strengthen the bones. You improve your bone mineralization. If you go out, you get exposed to sun, you improve your vitamin D levels. So exercise has all kinds of benefits that you can think of. Exercise is one of the most important antidepressants also, right? It gives you a break. It gives you a break from your routine. So all these factors are there. So it is exercise is important for maintaining good physical, metabolic, and mental health, in addition to the cardiorespiratory benefits. So I think it is very important. There is no reason why somebody should not be exercising.
Not even a single reason, sir, for not
Yes.
exercising.
And there are studies which have shown that even in very elderly people who have risk of fall and injuries also, exercise still has benefits over the all the risk provided. So they should not be avoiding exercise.
How much exercise is recommended?
So to maintain good health, these studies have shown that one should be exercising at least 30 minutes, at least 5 days a week. Now, there are other aspects of exercise. So, one bout of exercise improves your metabolic and other functions within next 2-3 hours. and this benefit lasts for 24 to maximum 48 hours. So if you skip one day of exercise, by next day your benefit starts declining. So it is important that you do a regular exercise, which is at least 5 days a week, and not absenting on 2 consecutive days, because your benefits will decline significantly. But in Indian setting, we have something called sarcopenic phenotype. Sarcopenia means that less muscle mass is there. We in Indians, we have for every whatever body weight we have, as compared to Western population, we have higher content of fat and lesser content of muscle. And because of that, our metabolic system kind of gets into derangement faster or earlier compared to Western population. And that is why we get diabetes at least 1 decade earlier as compared to Westerners. We get cardiac disease earlier than them. We have more severe heart disease, more severe diabetes, and so on. So, if with the regular exercise, it is recommended that Indians should be performing at least 45 to 60 minutes of exercise at least 5 days a week. And of this, at least 3 days a week, one should also do some muscle stretching or muscle training for about 15 minutes.
So can I take a question regarding BP medicine?
Why not?
With BP medicine, always mouth becomes dry in the night during sleep. It's a question from our patient.
It is never so. It is not with every medication. Depends on what medication you are taking. It may not be related to your medication. So dryness of mouth may be because of some medication, but may not be because of medication also. So you have to see why it is happening first. Second thing is you can simply take a few sips of water when you go off to sleep. I don't think there is much issue. But anti hypertensive or BP lowering medication is as important or maybe little more important for diabetes patients as compared to those who do not have diabetes, because diabetes per se causes damage to kidneys and eyes and heart, and if the blood pressure high is high, this damage gets multiplied. So it is not just additive damage, it is a multiplication factor there. So it is very important that all diabetes patients must keep their blood pressure level less than 130/80.
It's a very important question of the day is I had from a patient. Can I take double dose of diabetes medicine if I eat in excess on a particular day?
You should never change your medicine without consulting your physician. And you don't know how much effect the double dose of medication will have. So it is best that you don't deviate from your diet significantly when on any particular day. Even if you are deviating, doesn't matter, your sugar will shoot up for a day. In next 2 days, if you are not misbehaving with eating or anything and you are taking your medication regularly, it will fall down to the regular level. But doubling the dose is never a good idea, because you can't decide which medicine is going to cause which effect unless your physician has specifically told that okay, this is what you should do if you are taking a meal outside or you are eating this many calories. How will you calculate those calories in your food? That is also a challenge. So it is not to be double like that.
Usually, we guide our patients regarding carb counting.
Yeah,
So,
but
if you
carb
know your
counting
food,
is not very
huh,
important for type 2 diabetes. So, and
and
in Indian setting, most of the people are not comfortable with carb counting thing also. So here, most of the people just want to understand the basic. And the basic thing is you should not, and those carb counting thing, again, you have to give the insulin according to carb
yes,
counting,
not
not
with
the
oral
oral
agents.
medication.
Yes.
So I don't think that will help them much. Most important thing is they don't need to double the dose. Only thing is if they have gone out, they have eaten out, they should monitor their sugar very carefully for next 3 days to make sure that it is not going haywire. And if there is some significant change, they must consult their doctor.
Right, sir. Sir, I am through with my questions. Any other thing which I have left is or you want to cover, you can please add on.
Mm, I think we have covered most of the things. One important question is, most of the time when people are on insulin, they want to run away from insulin.
Yes, sorry.
So, always a question is there, can I stay away from insulin or can you stop my insulin? And we get patients, who will come and tell us, Doctor Sahab, मेरे को तो उसने बताया कि आप insulin बंद करवा दोगे मेरा. And in fact, on our feedback, somebody posted, that my insulin was stopped by doctor, so I'm so thankful. So it is, one has to understand that insulin is also a medicine. In fact, it is the natural thing that is present in body. Only thing is now we are giving it from outside. And as of now, we cannot make insulin preparation which can be given as a tablet or capsule, because it is a protein and it will be digested like any protein in food if it is taken orally. So it needs to be given as injection. So fear is not of insulin, fear is of the needle. If you tell the patient, look, I am giving you an insulin tablet, nobody will object. But the problem is of the needle. Now, second thing is people who need insulin. Some point of time, more than 50% of patients will need insulin. Type 1 diabetes, they need insulin at least 4 times a day. And they must be on insulin to make sure that they are not having any threat to their life. The minute they stop insulin, they can get into complications which can be life-threatening. Type 2 diabetes patients, more than 50% will require insulin some point of time. And if somebody needs insulin, it has to be given. There is no option that you can not take insulin and you can stay with high blood sugar levels. So one should never run from insulin. Insulin is just another important medication. If it is required in your case, you must take it. And in fact, people who are uncontrolled and they need insulin, and once you put them on insulin, they become so much better and they feel so good that they don't want to leave insulin afterwards. Then another option is, डॉक्टर साहब मेरे को इंसुलिन की आदत तो नहीं लग जाएगी. तो सबसे पहली आदत जो हमें लगी हुई है वो है खाना खाने की. पैदा होते ही लगी और सारी उम्र लगी रहेगी. जिस दिन हम खाना खाना छोड़ देंगे ये सब आदतें छूट जाएंगी. सो इंसुलिन खाना हम क्यों खाते हैं? क्योंकि हमारी बॉडी की रिक्वायरमेंट है. इंसुलिन भी हम इसलिए ले रहे हैं क्योंकि हमारी रिक्वायरमेंट है. सो इफ इट इज रिक्वायर्ड बाय द बॉडी, यू नीड टू टेक इट. It is not a habit forming thing, right? So there is no reason why one should be afraid of using insulin. If it is required, it is a must and it should be taken. So I think this was important thing which I felt.
Yeah, I missed it, sir. So can we end the session?
Yes, I think we can end the session now. Thank you everyone for joining, and hope these sessions enhance your understanding about diabetes and help you in managing your diabetes well. We'll be happy to receive your feedback. You can give your feedback on our Facebook page or Google page also. And if you have some queries, you want some specific issues to be addressed, please feel free, send us questions and we'll take up in our next sessions. Thank you.
Thank you everyone for joining.